Hello everyone, we will start. It's been 2 minutes and let's follow some time. So whoever can on the camera can on the camera, and otherwise what I need is all focus which would be required to know. I'm glad you all have joined today on a Saturday afternoon, though being it's a working day. So a little bit about me. अगर आप मेरे वेबिनार में पहले आए हैं तो गुड, अगर नहीं आए हैं तो मैं अपने बारे में आपको बताना चाहूंगी. मेरा नाम डॉक्टर स्मृति सोरडे है एंड मैं एक फिजियोथेरापिस्ट हूँ बाय पैशन एंड प्रोफेशन. सो आई एम बॉर्न एंड ब्रॉट अप इन नागपुर. इट हैज ऑल माई सोल. सो मुंबई की मेरा जो जर्नी है वो ग्रेजुएशन से पोस्ट ग्रेजुएशन तक था, और अभी भी मैं मुंबई में ही रहती हूँ. और मेरा जो एजुकेशन है वो केईएम में हुआ है, सेठ जीएस मेडिकल कॉलेज एंड केईएम हॉस्पिटल. एंड आई एम फ्रॉम द बैच ऑफ 2003. सो इट्स बीन good 22 years with physiotherapy, 23 rather. एंड मेरा पोस्ट ग्रेजुएशन कार्डियोवास्कुलर एंड पल्मरी साइंसेज में हुआ है. द ओनली रीजन कि मैंने पीजीसीईटी में फर्स्ट आते हुए भी कार्डियो लिया. जनरली लोग ऑर्थो लेते हैं, लेकिन आई टुक इट बिकॉज मुझे पता था कि कोई मुझे बाहर सिखाने नहीं वाला है कार्डियो. एंड ये जो सब्जेक्ट है हमारे वक्त पोस्ट ग्रेजुएशन 3 साल का था, और 3 साल का होने की वजह से बहुत सारे लर्निंग्स थी, बहुत सारे फेलियर्स थे जिससे मैं बहुत सीखी हूँ. और इसके लिए ही मेरा एक विजन क्लियर था 3 ईयर से कि मुझे मेरा क्लिनिक बनाना है, मुझे मेरा खुद का क्लिनिक डालना है. लेकिन अगर कार्डियोवास्कुलर पल्मोनरी साइंसेज नहीं लेती तो जिस कॉन्फिडेंस से आज मैं बहुत सीएबीजी पेसमेकर पल्मोनरी रिहैब कर रही हूँ, शायद वो इतना नहीं कर पाती. बिकॉज पीजी इन कार्डियोवास्कुलर हैज taught me a lot, and of course ortho had always my heart. Being an assistant professor to being a director of Vatsala Physio Clinic, it itself has been a journey. So I started my clinical practice 2007 में जेजे हॉस्पिटल में. एक होम फॉर एजेड था, एक प्राइवेट क्लिनिक, और होम विजिट से मैंने 2007 में क्लिनिकल प्रैक्टिस चालू की है मेरी. और माय हॉबीज रादर आई लव टू रीड. इवन आफ्टर माय कॉलेज लाइब्रेरी वाज माय हैप्पी प्लेस. तो अगर आप मुझे बोलोगे कि मैं फिजियो ही पढ़ती थी, नहीं, मैं कोई भी बुक पढ़ती थी लाइब्रेरी में जाके, एंड दैट हैज हेल्प मी टू गेन नॉलेज. सो एट second year I was aware of what was Cartan-Jenner syndrome. So that was how I used to learn during my college days. So learning never stopped for me. Even after 18 years of clinical practice, I'm pursuing my fellowship in a very interesting subject which I have taken. It's from physiotherapy only. So apart from physiotherapy and my around more than 20 certifications, what I have done is I am a Hoponopo healer. Hoponopo healer एक ऐसी चीज है जो हम लोग कैसे सबकॉन्शियस माइंड से हील करते हैं पेशेंट्स को. वो है, आई एम अ सर्टिफाइड लॉ ऑफ अट्रैक्शन कोच, न्यूरो लिंग्विस्टिक साइकोलॉजी कोच एंड अ माइंड पावर ट्रेनर. So if people who have attended my workshops before and my mentees out here, if there are any, so they know how I read the patients and how over the period of time I help them to overcome many things, which it's not only the part of physiotherapy. So yes, I'm a mother of two notorious boys, and people who know and who are here as a mother and have taken a maternity leave, let me tell you, your kids are not your weakness, they are your strength. In fact, they have helped me to prioritize my goals, and my priorities are always been juggling between three things, which I'll tell you later. So, Vatsala Physio Clinic is my own baby, and I have two branches. One is at Ram Maruti and other is at Godmandar Road. This is in Thane. So when we start a little bit, a little achievements which I have achieved in last few years is from how to run a clinic to winning the best entrepreneur award, not once or twice but thrice. What achievement itself. जब मैंने मेरी क्लिनिकल प्रैक्टिस चालू की थी, आई वॉज नॉट श्योर कि एक्चुअली कैसे क्लिनिक चालू करना चाहिए, कैसे पैसे मांगने चाहिए, कैसे असेसमेंट करना चाहिए. दो आई वॉज गुड इन माई क्लिनिकल नॉलेज, बट जब हम बिजनेस स्टार्ट करते हैं या जब हम कोई ऐसी चीज स्टार्ट करते हैं जहाँ पे एक बाटर सिस्टम है, वी आर टेकिंग charging patients for our services, then it was a challenge, and I have learned every day, every single day. It is a learning process for me. So that's the reason, did some good things, heal some hands, and uske baad mein I got this Best Entrepreneur Award. The best part about this journey, there is a picture in which I'm lighting the lamp. I was being called as a guest speaker by my own alma mater, say GS Medical College and KM Hospital. And if you see, there is a strong woman, there are three strong women standing over there, and one of them, which is with a black salwar, she is Dr. Sangeeta Rawat. She is the HOD of KM Neuro Department. She is the professor heading Neuro Department, and in her itself, she is a very big figure. So it was a privilege to share the stage with her. And now let's have this session as interactive. As you all know, we are having a total 90 minutes of this session. And let's start with certain challenges. Here, I will allow you all to give me any challenges you are facing. At the same time, I will help you to answer this. Whatever I feel, in my last workshop, people have this confidence to do assessment and decide the treatment. So when we actually start from a college, और जब हम कॉलेज में ही रहते हैं, बहुत सारे स्टूडेंट्स ने भी ये वेबिनार के लिए रजिस्टर किया है. तो जब हम कॉलेज में ही रहते हैं, तब ये होता है कि वी आर एक्चुअली नॉट एबल टू डिसाइड कि अरे लो बैक पेन है तो IFT तो लगाना है. सो हमें पता नहीं चलता है कि एक्चुअली कहाँ से असेसमेंट चालू करना चाहिए और इस पर्टिकुलर पेशेंट को कितने दिन लगने वाले हैं ट्रीटमेंट के लिए. सो दिस ऑल विल डिपेंड ऑन आपको कौन सा प्रॉब्लम मिल रहा है पेशेंट में. अगर मैकेनिकल लो बैक पेन है, अक्यूट फेज में है, तो जल्दी ट्रीटमेंट होगा. अगर क्रॉनिक फेज में है तो लेट ट्रीटमेंट होगा. लेट ट्रीटमेंट होगा मतलब ड्यूरेशन ज्यादा लगेगा, ट्रीटमेंट ड्यूरेशन हमारा चेंज होगा उसके हिसाब से. सो इसलिए बहुत इंपॉर्टेंट है टू ऑल प्रेजेंट ओवर हियर कि जब आप असेसमेंट कर रहे हैं तो आपको पता चले कि ये पेशेंट का जो दर्द है कितना पुराना है. पेन असेसमेंट, मोबिलिटी असेसमेंट, स्ट्रेंथ एंड द एक्टिविटी लिमिटेशन, इट्स वेरी इंपॉर्टेंट. और इन सब की वजह से उनका क्वालिटी ऑफ लाइफ कैसे हुआ है. पिछले वेबिनार में आई हैड लॉट ऑफ स्टूडेंट्स हु हैड आस्क्ड मी, इनफैक्ट दे वर नॉट श्योर, सेकेंड ईयर एंड थर्ड ईयर के स्टूडेंट्स की, इज माई डिसीजन राइट टू चूज फिजियोथेरेपी. Absolutely, you are here, and what worked for me may worked for many. So the decision I choose physiotherapy was, I knew that it is something which will help me grow. At the same time, it will help me to maintain my own health. If I would have chosen some field where I have to do night shifts also, so as a female, शायद मेरे लिए थोड़ा दिक्कत रहता था. First thing, this is the planning part. Second is the monetary part. The more you invest on your learnings, the better you earn. So as I told you, I am a lifelong learner. ऐसा नहीं है कि मेरा ग्रेजुएशन हो गया और मैंने पढ़ना छोड़ दिया. आज भी मैं मेरे बेसिक्स के लिए जाती हूँ. आज भी अगर मुझे कुछ भी डिफिकल्टी रहा तो आई रेफर माय फर्स्ट 2 years के नोट्स. Yes, I do have it, and my notes were very precise always, and that's the reason i I am here to tell you that what is that makes you a physio which stands out from the crowd. So this is why I feel that even if you have chosen physiotherapy, the decision to continue with physiotherapy would be the wisest decision ever. And believe me, if you are a student now, 3 years, 4 years down the line, we will meet somewhere and you will say, yes, ma'am, I'm a proud physiotherapist. So one of the incident which I would really love to share, why physiotherapy didn't only give me my financial growth, but even a job satisfaction. We had a patient 2 years back. She was only 10 days old. 10 days. 10 days. So her parents had got connected with me looking at my YouTube channel, and they were like, ma'am, इस ये हाथ नहीं उठा रही है. और जहां से उनको ये पता चला, एक हमारे मैं थाना में रहती हूँ और यहाँ से करीबन 30 किलोमीटर दूर देयर इज अ प्लेस जहाँ पे रूरल एरिया है वो, और वहां पे वो बच्चे की डिलीवरी हुई एंड उसको अर्ब्स पल्सी था। अर्ब्स पल्सी होने के बाद वो डॉक्टर ने उन्हें बोला कि प्रोबेबली कोई हड्डी फ्रैक्चर है, और एक्सरे में भी उन्होंने निकाला कि नॉर्मल एक्सरे था बट बोला कि ये हड्डी फ्रैक्चर है, हमें ऑपरेट करना पड़ेगा 12 साल के बाद। लेकिन जब मैंने वो एक्सरे देखा और यहाँ के भी डॉक्टर्स ने एक्सरे देखा, तब पता चला इट इज नथिंग, द एक्सरे वाज परफेक्टली नॉर्मल। व्हाट द चाइल्ड हैड वाज Erb's palsy. During normal delivery, the head is sometimes stretched and there is pressure at the brachial plexus, and उसके वजह से hand movement जाता है। In 18 sessions, the child got the movement back, and that day I was happy. But what topped it was the grandparents and the parents were so happy, they named the child as Smriti. I think my decision to choose physiotherapy was banged on that day when the child was named behind the physio who treated it. So these are the small moments along with financial growth you will get when you are in physiotherapy. So the other normal question is, will the patients pay me? Yes, they will pay you if you value your own self. If you are ready to pay for your own growth. If you are ready to acknowledge that you know. See, there are many physios who are so good, but sometimes they don't feel that they are doing the best. It is the denial which keeps us a little behind. It is always our own challenges that keep us a little behind, और हमें ऐसा लगता है कि नहीं मैं ये कर नहीं पाऊंगी. The fact is we can do it if you do it in an organized way. How can I charge? Definitely we can charge. Let me give you a simple calculation. We had one of the student in last webinar where she was a little worried, ma'am, how can I charge? My answer to her question was, of course you can charge how many hours you have devoted to physiotherapy. So today the graduation is for 5 years. What she had completed 4 years back, it was 4.5 years. So that sums up to around 38,000 hours of your life. Then there are workshops which are done. That sums up to around 2,000 to 3,000 hours of your life. The investment which you have put in your graduation is around 5 to 6 lakhs. And not to forget the blood, sweat, and tears you have given during this process. So if you look behind, you have given a lot. So you can definitely charge your patients. Charges doesn't mean that you will just simply say whatever, but then I'm not here to decide your value. You have to decide your own value, that how much you want to charge. But don't keep any doubt in yourself कि मैं कैसे charge करूँ patient को, मैं लूट रही हूँ क्या उन्हें. No. We are charging for your skills. If I'm sitting in front of you and delivering this lecture, this is not one day preparation. I took 18 years to come here and deliver. There were a lot of nights which I have not slept. There were a lot of early mornings which I woke up and studied during my graduation, during my post graduation, and I still do that because I'm upgrading my skills. So, how can I charge? Of course, you're charging for your skills, you're charging for your knowledge. And many questions are like, will physiotherapy work? Physiotherapy does work and it works beautifully. Any one single case can you tell me that physiotherapy काम में नहीं आता है? If I see a pregnant lady, yes, we as a physio deliver value. If I see a geriatric patient, we as a physio deliver value. If I see a pediatric Erb's palsy case just 10 days old, 10 days old, yes. In NICU, 1 hour old, मिकोनियम एस्पिरेशन हुआ है, उसके बाद हमने कुछ फिजियो दिया, या फिर कुछ ऐसा कंडीशन है जहां पे चेस्ट पीटी का जरूरत है. Physio is something which starts from the first hour of your life and continues till the last hour. So that's the reason always physiotherapy will work. When physiotherapy will not work, when you will stop working, when you will not believe that physio will work. So here I want to give you one example. Everyone over here whether nowadays it's a male or it's a female, we have to cook something for ourselves. अगर हमने मैगी भी कुक किया या बिरयानी कुक किया, आपको जो रेसिपी बताई गई है, अगर आपने वैसे ही कुक नहीं किया तो जो फाइनल प्रोडक्ट आने वाला है वो अलग ही आने वाला है. सो दैट्स द रीजन वी हैव मेंटर्स. वो हमें रेसिपीज बताते हैं कि, और हमारे टीचर्स, नॉट टू फॉरगेट, नॉट टू from where we have come, our first year, second year, third year, our journey in our college. So if they have taught you, then they have taught you not only from the books, they have taught you from from their experiences. So that's the reason I always say that physiotherapy will always work. It is our self-doubt to know that will physiotherapy work. So my vision and mission for mentorship program, I was very crystal clear when few years back I decided that I want to start my mentorship program. So I want you all to see a video and we will meet again in 30 seconds.
अपनी औकात से बड़ा, अपनी हैसियत से बड़ा सोचते रहना चाहिए. क्या पता ऊपर वाला देख रहा हो और कह दे तास्तु बहुत मेहनत करना, क्योंकि बहुत मेहनत करने से हो जाता है. मैंने करके देख लिया है, हो जाएगा. एक दिन आएगा सब कुछ खाएंगे, अब घर से निकले हैं तो इतिहास लिख कर ही जाएंगे. मैंने पापा को ऐसी मूवमेंट में बोल दिया, मैं क्या यार पापा पापा यार हार गया मैं. देन ही रिप्लाइड कि हेलो भाई साहब, जाकिर से बात करा दो. मेरा जाकिर हारता नहीं है. अपनी औकात से बड़ा, अपनी हैसियत से बड़ा सोचते रहना चाहिए. क्या
You were not able to see the video? Can somebody I'll play the video again and we will see whether it's getting played.
अपनी औकात से बड़ा, अपनी हैसियत से बड़ा सोचते रहना चाहिए. क्या पता ऊपर वाला देख रहा हो और कह दे तास्तु बहुत मेहनत करना, क्योंकि बहुत मेहनत करने से हो जाता है. मैंने करके देख लिया है, हो जाएगा. एक दिन आएगा सब कुछ खाएंगे, अब घर से निकले हैं तो इतिहास लिख कर ही जाएंगे. मैंने पापा को ऐसी मूवमेंट में बोल दिया, मैं क्या यार पापा पापा.
So we are having webinar or technical issues now, ऐसा हो ही नहीं सकता. So we are having one issue that the video is not getting played. I will stop sharing the PPT and I'll come again and then we'll see whether it is getting played.
अपनी औकात से बड़ा, अपनी हैसियत से बड़ा सोचते रहना चाहिए.
Yes, I hope you all were able to see the video. Anybody who can actually reply? Okay, anyways,
Yes,
this
ma'am.
video was about one of my most favorite, Zakir Khan, where he was saying that you should dream bigger than what you feel. And there are things where you just have to say that you have to do it and that will happen. That's the reason many a times we feel that ये मुझसे नहीं होगा, ये assessment मुझसे नहीं होगा, ये patient treat मुझसे नहीं होगा. But believe me, we as physios are known to prevent surgeries. Yes, we are known to prevent surgeries. जब डॉक्टर बोलते हैं last option surgery है, there comes a physio and changes the game. So my vision and mission for the mentorship program is to actually have the clinical practice by physios, which will deliver quality results, and they will have confidence in themselves when they will talk to the patient. So when we talk about mentorship program, it is more of working on ourselves and on our basics. So when I talk about the five keys to the clinical practice, then this is what it means to me. So what you see today me after 18 years of my practice, it is my confidence, the clinical skills I have, the communication, the diagnosis, the treatment skills and the patient conversations. Patient conversations means when patient talk to me, they feel okay, mera treatment ho jayega and I will get better. So this was not done overnight. There were many late nights and early mornings which I have to come over. And this all was along with being a full-time mother. So in my last session, there was a physio who was thinking why I should start back after my maternity leave, because now my child is taking a lot of time. But believe me, that is your strength. The failures you have come through, more the failures, more the sacrifices, I think better is the progress, better is the growth chart. And I have always been a listener to know what the exactly the other person feels and says. There were a lot of disappointments, but my habit of choosing my mentors, investing on my learnings, upgrading myself every single day, and not to forget, keep on reading. So, as I told you, I'm a Zakir Khan fan. So am I a Robin Sharma fan. And I truly believe in something called as being the best version of yourself. There is nothing as perfection. I cannot be perfect in my assessment even now, but I know that what I am doing is not wrong. That is a gift physiotherapy can give you, that when you touch the patient you will know that what you are doing, it's not wrong. So how do I get all these skills, what you see as the tip of the iceberg, my success, how do you see that? Okay, so this was accomplished by me by following certain basic things which I have followed in last 18 years of practice. My 5 keys to a successful clinical practice is learning on the basics, my physical diagnosis, patient education, documentation, and being a lifelong learner. So, just to tell you all that we are providing e-certificates for this webinar, and those who attend the entire webinar will be filling out a feedback form and then they will get a certificate. So, the first key is basics. So, basics, they never go out of style. Revisiting them again and again will give you a different perspective. So I love to share this example. If you think of any good movie which you have seen, or your favorite movie, like my favorite movie is, for example, Jab We Met. So every time I see that movie, I feel that I am listening to a new dialogue. The same follows with our basics. Every time we go through Chaurasia anatomy, time we go to Semulingam Guyton, we always find a new sentence which will actually open our doors towards new learning. So जब हम कॉलेज में होते हैं, हमारा पर्पस बेसिक्स पढ़ने का अलग होता है, वो पास होना होता है, वो मार्क्स लाना होता है. जब हम क्लिनिकल प्रैक्टिस के हिसाब से पढ़ते हैं तो हमारे सभी दरवाजे खुले रहते हैं. तब हमारा ये रहता है कि ठीक है, अगर ये मैंने मसल्स को हाथ लगाया है तो इसका इम्पैक्ट शोल्डर पे क्या पड़ेगा. सो अभी इसमें मैं शोल्डर जॉइंट बताना चाहूंगी. बहुत सारे पेशेंट हमारे पास आते हैं शोल्डर पेन लेके. हर एक शोल्डर पेन एक तो फ्रोजन शोल्डर नहीं होता है. दूसरा, जब हम फ्रोजन शोल्डर या फिर शोल्डर पेन ये देखते हैं तो हमें सिर्फ शोल्डर को हाथ नहीं लगाना है. ये जो पीछे की आपको मसल्स दिख रही है, जैसे स्पाइन ऑफ स्कैपुला, ये मेरी सरफेस एनाटॉमी हो गई, इंफ्रास्पाइनेटिस, टेरेस मेजर, टेरेस माइनर, लैटिस्मस डोर्साई, रोम्बॉइड्स. इंफ्रास्पाइनेटिस हमने थ्योरी में इतना कम बार पढ़ा है, बट बिलीव मी फ्रेंड्स, व्हाट इज very important in clinical practice are these muscles. So when we do actually shoulder assessment, फ्रोजन शोल्डर में हमें सिखाया जाता है कि सिर्फ कैप्सूल अफेक्टेड होती है. नहीं, बाय द टाइम द पेशेंट कम्स टू अस, everything is affected. We have even seen patient having QL pain on the same side. QL is quadratus lumborum on the same side, and the pelvic is height on the same side of the shoulder. काफी बार we do a lot of matrix rhythm therapy and a lot of osteopathy. So when we are dealing with such patient, अगर हमने वो muscle release की तो हमारा shoulder भी release होता है. That is the importance of learning basic and revisiting them every time whenever you have time. So, as you see, this image I have got from Instagram. My Instagram is only to learn and revisit my basics. And of course, it is for my own growth. So when I am looking at it, my goal to do that is different. So when we are actually talking about and dealing about how surface anatomy is important, this is how it is important in your clinical practice. In college days हमें लगता है कि हाँ ठीक है ये मसल यहाँ पे है, ठीक है, लेकिन कभी कभी नी पेन के पेशेंट्स को भी एएसआईएस और नेवल के बीच में पेन होता है, बिकॉज मेरी जो स्वास मेजर मसल है वो वहां पे रहती है, एंड इट हैज अ रिलेशनशिप बिटवीन माय नी एंड माय स्वास मसल. सो इतना इंपॉर्टेंस है एनाटॉमी जानने का, बेसिक्स जानने का और मसल्स जानने का. सो अभी फिजियोलॉजिक पे अगर हम आते हैं, तो गट ब्रेन कनेक्शन जो हम बोलते हैं या गट ब्रेन एक्सेस बोलते हैं, जैसे हम अपने काफ मसल को सेकेंड हार्ट बोलते हैं, वैसे हम अपने सेकेंड ब्रेन हमारे गट को बोलते हैं, दैट इज अ डाइजेस्टिव सिस्टम. सो इसमें बहुत ही एक कॉमन एग्जाम्पल आई वुड लव टू गिव यू ऑल, दैट अगर एग्जाम रही तो हम देखते हैं किसी किसी को भूख नहीं लगती, वॉशरूम जाना पड़ता है, लूज मोशंस होते हैं या कॉन्स्टिपेशन होते हैं, बिकॉज द ब्रेन at the brain level we are stressed out, and so the gut is behaving the same. And when the gut is behaving the same, we are actually trying to reconnect how it is happening. So this is the connection. Our gut is the second brain. It realizes the stress, the changes in the brain physiology very quick. The immune system in RA patients, in Parkinson patient, in stroke patient, even in cancer cases, we have seen a lot of IBS happening because the immune system is compromised. The vagus nerve, which is set to help us in many ways nowadays, vagus nerve stimulation and all लिखना है, it helps to connect a circuit between our gut and the brain. And that's the reason we have a lot of connection between these two structures. So अगर आपको इन दोनों चीजों का connection पता रहा, so it is always better, always better to treat the patient, because जब हम ऑस्टियोपैथी करते हैं, which I'm going to talk in my next webinar, and my ebook also has a little bit about it, कि why the visceral connection is related to the musculoskeletal connection. So if there is some issue at this level, how I treat my viscera and how I get results in the musculoskeletal patients. So this is about basics. Physical diagnosis. So when we talk about physical diagnosis, what is physical diagnosis? So physical diagnosis is what, as a physiotherapist, you're blessed to do. You can diagnose the patient. So when a patient comes to you from a doctor saying that L3, L4 disc prolapse, TENS, IFT, ultrasound, everything. But you as a physio can know what is actually the source of pain. And sometimes the source of pain is only one or two muscles, like the erector spinae or the psoas, and that's the importance of assessment. So we have in-depth assessment and we have our own special test to know which structures are affected. So if the condition, the medical diagnosis is lumbar spondylitis, your physical diagnosis will be that specific muscle, like quadriceps strain, patella tendonitis लेके कोई patient आया है तो we know it's a quadriceps strain. अगर RC strain लेके आया है तो we have our own test, जहाँ से speed test, empty can test और बाकी के टेस्ट जहाँ से हमें पता चलेगा कि कौन सी मसल ज्यादा इन्वॉल्व है, क्योंकि हमारे रोटेटर कफ में भी 4 मसल्स होती है. सो विच पर्टिकुलर मसल इज मोर इन्वॉल्व, ये हमें फिजिकल डायग्नोसिस से पता चलेगा. सो व्हेन यू हैव योर फिजिकल डायग्नोसिस, अगेन वी आर zeroing down to our basics, our muscles, the origin insertion. So when we are having that, we know that actually कौन सी मसल ज्यादा अफेक्टेड है. And without knowing this, without our assessment, our treatment just becomes a guesswork. Then It is just like putting machines mechanically and we don't know anything. But if we know properly what is physical diagnosis, the challenges which I have told you all are covered. Because no, you know, when you are touching a patient, where is the root cause? You are not treating the symptoms. We have patients who send us MRI report, who send us X-ray reports and tell कि इसकी treatment होगी क्या? A MRI report will not tell me the clinical symptoms in that patient. What is the patient presentation is very subjective. दो MRI report अगर same रहे, दोनों में भी अगर डिस्क herniation है, bulge है, ऑलमोस्ट सभी फाइंडिंग सेम है, तो दो पेशेंट के क्लिनिकल सिम्टम सेम नहीं रहेंगे, बिकॉज वो फर्क कैसे पड़ेगा? हमारे असेसमेंट में। हमारा असेसमेंट हमें बताएगा कि एक्चुअली सब बराबर है और कौन से एरिया से पेन आ रहा है। तो अगर हम लोग क्वाड्रेटिस लंबोरम की बात करते हैं, वी नीड टू चेक स्पाइन में कौन कौन सी मसल्स अफेक्टेड है, एंड इसी हिसाब से हम लोग हमारे रूट कॉज पे जाते हैं। सो जब हम ये डिफरेंशियल डायग्नोसिस या फिर हम अपना फिजिकल डायग्नोसिस के लिए जाते हैं, डिफरेंशियल डायग्नोसिस में वी सी ऑल द टेस्ट कि जॉइन है, बर्सा है, मसल्स है, सिस्टमिक है, लिगामेंट्स है, रेफर्ड पेन है। इसमें सबसे इंपॉर्टेंट है कि वी शुड नो कि सिस्टमिक क्या है, द रेड फ्लैग्स। समटाइम्स इट्स मोर इम्पॉर्टेंट टू नो द डोंट्स कि क्या नहीं करना चाहिए देन क्या करना चाहिए। जैसे हम एक टीकेआर केस में अल्ट्रासाउंड नहीं देंगे, इट इज नॉट यूज्ड इन पेशेंट्स हैविंग मेटल्स, लेकिन आई कैन गिव पीएमएफ, आई कैन गिव मैट्रिक्स। In pacemaker cases, I can give matrix. So that is the importance of knowing a physical diagnosis. Now, in this, I want to give you one example, a very short story actually. So there was a big cruise, and they were having some technical issue that cruise was not starting, the engine was not starting. और जब वो इंजन स्टार्ट नहीं हो रही थी, तो उन्होंने बहुत बड़े बड़े दिग्गज लोगों को बुलाया, मैकेनिक्स को, कि क्यों बंद हुआ है, क्या प्रॉब्लम हुआ है। तो मेनी ऑफ देम वर नॉट एबल टू सॉल्व इट, एंड देन एक छोटा सा मैकेनिक आया जिसका बहुत छोटा दुकान था, एंड उसने सिर्फ इंजन देखा, एंड 5 मिनट्स के बाद द इंजन स्टार्टेड। सो दे वर वेरी मच सरप्राइज्ड कि बाबा ऐसे कैसे स्टार्ट हो गया इंजन, इतने सारे लोग तो देख के गए। एंड देन दे वर लाइक कि चलो वेरी गुड, आवर वर्क इज डन, व्हाट आर योर चार्जेस? सो ही टोल्ड दैट माय चार्जेस आर $2000. सो दे वर लाइक ओनली फॉर 5 minutes यू आर चार्जिंग $2000? सो और इतने सारे लोग, इतने बड़े बड़े मैकेनिक्स देख के गए, उन्होंने सिर्फ $500 लिया, $100 लिया। वाई सो? आई एम जस्ट टेलिंग यू टेंटेटिव फिगर्स। सो व्हाट यू नो व्हाट फ्रेंड्स ही टोल्ड, आई न्यू कि मुझे कहाँ हथौड़ा मारना है या मुझे कौन से जगह पे काम करना है। सो ही न्यू कि रूट कॉज क्या था। So again, we are coming back to the challenges. Ki how can I charge my patients? Of course, when you know how to treat the root cause, you're not treating the symptoms, you're treating the root cause. So very well, that is the time you will have the confidence when you are investing on yourself in your reading, in your upgradation of skills, and actually getting back to learning from where you have started the physiotherapy journey. So इसमें मैं आपको एक एग्जांपल लूंगी. There are so many patients in our practice every day. At least we have 5 to 6 patients coming with medial joint line knee pain. अभी medial joint line knee pain एज के हिसाब से डिफरेंशियल डायग्नोसिस इसका वेरी करता है. बट लेट्स टेक अ कॉमन एग्जांपल of 40-year-old female is coming to me and telling me that I am having medial joint line pain. But you know, medial joint line pain, in many cases, even when we are in a college, we feel कि okay, OA नहीं हुआ होगा looking at the age of the patient. But many a times, it can be a pessancurous bursitis. There are so many things, and this particular example I can give actually around 12-13 cases or 12-13 diagnosis, physical diagnosis, which can actually happen when there is a medial joint line pain. And I have taken this particular topic separately in my classroom to clinic webinar. So this is something which we should know. So when we are talking about physical diagnosis, if we are touching the patient 2 to 3 centimeter just below the medial joint line, it is the area of the pes anseres bursa. If it is at the joint, it is the area of the proper joint line. If I am twisting, it is something else. And you know what is it? It can be a ligament, medial collateral strain when I'm doing the test. So there are so many things which will come in the medial joint line, and I have taken this in detail in my classroom to clinic webinar. So this is physical diagnosis, and it is so important to know our physical diagnosis when we are treating the patient. So we have to be the best mechanic of the human body. So when we are touching the patient, we should know where we are actually targeting and where we are taking the treatment. So the third most important part I feel is the patient education. Why patient education is important? When a patient comes to us, comes for physiotherapy, many a times it happens that they are coming to us after visiting 10 people, and there was some good man who told them that physio will work. Because as you all know that the lack of awareness amongst people regarding physiotherapy takes them under the knife for not so good reasons. So patient education here plays a very important role. So when we start in the consultation, it is actually very important to tell the patient that why he has come for physiotherapy and why it will help to recover. So the first thing first, patient education is pain education. If somebody is coming to me and telling कि my pain on VAS is 6/10, मतलब moderate pain है, so or it is a shoulder pain and it has been 6 months to that pain, मतलब chronic pain हो गया, 6 months का है, 6 दिनों में नहीं निकलने वाला है, मेरे असेसमेंट से मुझे पता चलेगा कि वो एक्चुअली कितना टाइम लगने वाला है रिकवरी के लिए. So we have to be very honest to the patient कि how much time is required, because in this case shoulder pain 6 months old, I am not treating the pain only. Now the patient is having stiffness, now having weakness. There are some activity which are limited now. And most important, the strength of the muscles are not good. So जब हमें कोई बोलता है कि 10 सेशंस में फिजियो ले लो, तो that is called as symptomatic recovery, which I personally feel is just putting band-aid on the wound. It will not heal from within. It will just help to keep it safe. So 10 दिन का ट्रीटमेंट लेने के बाद if they exert, they will have pain again. So we have to educate the patient in this pain education that recovery is never a straight line. What you feel is just shoulder में pain है, वो pain actually सिर्फ shoulder में नहीं है, it is actually going in the middle back, upper back, neck, and sometimes, as I told you, even till the pelvis, that is the QL area. So pain education is very important. They should know that when we are touching them, when we are starting the treatment, they can expect a increase in pain for 3 to 4 days. क्योंकि अगर मैं किसी टिश्यूज को जाके छेड़ रही हूँ, आई एम ट्राइंग टू रिलीज देम, आई एम ट्राइंग टू गिव देम ट्रीटमेंट, वी आर स्टार्टिंग द एक्सरसाइजेस आफ्टर 3-4 days, so the tissues will react and their pain may come. So recovery is never a straight line is one of the most important things in patient education and pain education. So patient feels कि आज अगर मुझे रिकवरी 10% है, तो कल मुझे 20% रहेगी, परसों मुझे 30% रहेगी. बट इट्स नॉट लाइक दैट. आज प्रॉबेबली 10% रिकवरी है, लेकिन परसों 30% रह सकती है, उसके बाद ही कैन फील बैक टू स्क्वायर. But again, we need to make them understand that it is a graph which is going up but there are lots and lots and lots of ups and downs. So this is the pain education part. So when after the assessment part, you see the patient, you do your special test, you do कि कितना weakness है, कितना tightness है, कौन से activities limited है, कितना range of motion available है, उसके हिसाब से आप पेशेंट को, आपको पहले पेशेंट को पूछना चाहिए कि what are your treatment goals. If you are coming to me for your physiotherapy, what are your treatment goals? So probably a football player who is actively playing football as a profession, he needs more treatment because the occupational demands are so. But a weekend football player or somebody who has just played football and एक ही मैच में इंजरी हुई, उनके रिक्वायरमेंट्स अलग रहेंगे. So physio goals and the patient goals should be aligned when we are talking about treatment goals, because these two things which will really help us to know that actually how much duration of time is required. Strength never comes in 10 days. Strength takes 21 to 90 days to start coming up. इसमें example which I give to our patients, that if you go to a gym today, if you are lifting 1 kg, tomorrow you may not lift 1 kg, 5 kg. You have to do it progressively. So in patients also, यहाँ पे तो pathology है. So उसमें भी हमें धीरे धीरे, we have to start with muscle activation exercises, static exercises. So that comes in your treatment goals again. And when, as a physio, but when you explain the patients about modalities used are depending on what all you are using. In my clinic, we use right from matrix rhythm therapy, PEMF, osteopathy, cupping, needling, all the exercises, IFT, TENS, ultrasound stimulation, everything. But we choose according to what is required for the patient, and we do suggest them whatever is required, and we are very honest about the timeline. Friends, let's be very honest when it comes to recovery. What the patient expects when he comes to us कि 10 session ले लिए और हो गया. But we should open their eyes and tell them कि no, it is not 10 sessions. 10 sessions is like a symptomatic recovery. अगर ताकत नहीं आएगी तो you will meet me again after some days. बहुत सारे पेशेंट्स बोलते हैं मेरा पेन कम हुआ है, लेकिन जब भी मैं चलता हूँ तब दोबारा पेन हो जाता है नी केसेस में, बिकॉज स्ट्रेंथ नहीं आया है. सो modalities use and timeline is very important when we are doing the patient education part in the treatment plan. So treatment goals and modalities and timeline, we have a proper format to decide this, and we use it. And I'm going to share this again in our classroom to clinic webinar, where we actually decide what is the timeline taken for the patients. And before that, we come to know how the pain is there, what is the type of pain, what is the source of pain. So these basics help us to decide the treatment plan. The other aspect is communication skills. As I told you, the patient tells us more than 60% of the diagnosis in the history itself. If the patient is telling me, I'm very good when I get up in the morning, but by the end of the day, I'm having back pain, that is mostly the mechanical low back pain that the patient is having, which we confirm with our assessment skills. So the patient is telling us their diagnosis in the history. And when this is happening, we are actually trying to communicate with them and cross with the clinical findings whether whatever history presentation is given is right or wrong. So communication skills, we should choose the words that empower and not frighten the patients. And for example, a very small example, I'll say that when patients come to us, there are patients who are in their 40s, and if they are having knee pain, there are people who tell them ki you are having osteoarthritis. Why a patient at early 40s will have osteoarthritis only? It can be a normal knee pain. which has come because she walked a lot. She has come, went to some vacation and उसके बाद pain हुआ. So we have to tell them that it, let me assess you first. It cannot be just arthritis. And in simple terms, if I term arthritis also, I will say that it is a normal aging changes which have happened in your knee. If the patient is 55-year-old, these are the aging process. These are the changes which happen with the age. दैट इज द डीजेनरेटिव चेंजेस. बहुत सारे एमआरआई में लिखा हुआ आता है डीजेनरेटिव डीजेनरेटिव डीजेनरेटिव. एंड अचानक पेशेंट को ऐसा लगता है कि नहीं, मैं 4 दिन पहले गिरा उसके बाद ये हुआ. तो डीजेनरेटिव चेंजेस आर एक्चुअली द एजिंग चेंजेस विच आर देयर. वी आर नॉट टेलिंग देम कि आर्थराइटिस इसलिए है क्योंकि आप गिरे थे. इट व्हाट इज आर्थराइटिस? इट इज अ डीजेनरेटिव कंडीशन and it will happen with the normal aging process. And believe me, there are so many articles which say that with exercises we can actually get back 4 years of our age, because the strength is increasing after 40s. Nowadays, even after 35, 35, the muscle loss, the lean muscle mass decreases. After 40s, it is more less, and at 42 it peaks. That's the reason a lot of females have early menopause also, because strength training is not there. So when we are deciding the treatment plan also, we need to know that strength training is so important, and the assessment, the strength is so important. How on MMT we grade the patient. So whenever we are doing this, we need to be very clear in our communication skills. So understanding the condition, when we are understanding the condition of the patient, we are asking them कि what do you think that कि आपको घुटने में क्या हुआ है. So believe me, there are certain patients who actually cry their heart out saying कि मैं सिर्फ 42 हूँ और मेरे घुटनों में ये तकलीफ हो गया है और मुझे अभी चल के नहीं होगा. Because that is how they are being conveyed. दैट इज हाउ दे आर बीन टोल्ड कि अभी स्टेयरकेस नहीं चलना है, पालथी मार के बैठना नहीं है, बहुत वॉक नहीं करना है, कोमोड यूज करना है. यू विल सी इंस्ट्रक्शंस रिटन इन द फाइल. जो भी हमारा फंक्शनल रिक्वायरमेंट है जॉइंट का, और जो जॉइंट जिस काम के लिए बना है, हम उसको वही अलाउ नहीं कर रहे. ऑफ कोर्स वी आर रिस्पेक्टिंग द पेन, एंड उस विंडो पीरियड के लिए probably we will tell them to avoid these, but they are being told to avoid this by people for lifetime. तो जो हम यूज नहीं करेंगे उसको रस्ट होने वाला है, and uske baad they will ultimately land up with complications, surgeries which were not required actually. This will not happen over the period of time, this will happen in few years. So that is why it is important to explain them the diagnosis and the anatomy and pathophysiology. When I talk about anatomy, they have the x-ray. अगर हम नी का बात कर रहे हैं तो हम उनको बताएंगे कि medial joint space क्यों reduce हुआ है. What is the importance of that medial joint space and your weight? There are so many articles which state that 1 kg of body weight comes as 4 kg on the knee. Few articles say that it is 2.5 kg on the knee. Even if I consider anything on average that is 3 kg, anyone having weight gain of 5 kg will be loading their knee by 15 kg. That is huge. 15 kg is almost a 7 to 8 or 6 to 7-year-old kid. So just imagine the knees are taking so much pressure, so much pressure. So here we need to know some basics of what is the relation between the weight and the medial joint line pain. Another very much underrated things which we include in patient education is vitamin D3, B12 and magnesium. D3 is so much underrated and people feel only the function of D3 is calcium absorption. But the functions of D3 are even immunity reduction, even hair loss, even mood swings, even recurrent cold and cough. And if we talk about bone health, yes, calcium absorption. If a patient is having recurrent cold and cough, the immunity is suppressed, hair loss, we never tell them to actually check the D3, which should be done, because this all will hamper. See, if there is viral going on every time, that means their body is undergoing a lot of strain, and with this, the muscles will be in inflammation, because the normal tests like ESR are increased, which tells us the inflammation in the body. And with that, the pain comes up because the muscles become weak. Okay, so D3, B12 is to be done with the nerves, and magnesium. Magnesium is something which is very much underrated. So we should tell the patients that why it is important to know all these factors. Okay, and with diagnosis, we explain them the diagnosis. So first, as I told you, is D3, B12, magnesium. Second is sleep. Sleep is very much underrated again. So our body heals itself, and we have, apart from our neurons, there are many cells which actually replace. So there are certain cells which replace themselves from a span of 3 days to 35 days to 3 months. So one of the commonest example is the liver grows. So that's the reason the liver transplants, when they are done even from a relative, because the liver has the potential to grow. And when this maximum healing happens is from 10:30 to 4:30. So that is the healing time. That is the healing time, and that is the body's time to repair the wear and tear. And when we are repairing the wear and tear, that is the time we get good results and peak results. In diabetes patients, why the recovery is a little slower than other patients? Yes, definitely because of the sugar levels, the sugar laden blood. And second is, in diabetes patients, most commonly they see is night pain. So we should know the pathophysiology in such patients. And then the water. Third is the water intake. Our body is 70% water. So if my system is taking only 3 or 4 glasses of water, that is not even 1 liter of water, and our body requires, after every 20 kg we need 1 liter of water, and on an average we need around 3 to 3.5 liters of water. If you are not drinking that much water, of course muscles जो है वो spasm में जाएंगी, और muscle spasm में जाने की वजह से हमें पेन स्टार्ट होगा. पेन स्टार्ट होने की वजह से then we will have referred pain. So this is the reason it's very important to track the water intake details of the patient. And fourth is the stress. We cannot do much about the stress. जिसको stress देना है वो देगा ही stress. But if vitamin D3, B12, magnesium, sleep, and water intake are in check, we are good to deal with the stress. Okay, so this is about patient education. And many a times, when I take interviews, people don't know about what is cross syndrome. So I'm going to cover this in my next webinar, which is Classroom to Clinic, and we have launched our ebook also, in which it is given that which all muscles are involved in this. But do you know that knowing a basic of um, cross syndrome, the upper cross syndrome and lower cross syndrome, can help us to diagnose so many things, so many things. So here I want to tell you one example, that there are so many patients who come with frontal headache, and many a times we feel कि ये migraine है क्या? But the referred pain of a sternocleidomastoid muscle is frontal headache, eye heaviness, scaleni muscle रहेगा, so it will be again eye heaviness. They will feel that there is something over their head. So this is our basic knowledge. So we can do a better patient education when the physio education is done well. That are the basics. So this is how we come to know that why it is important to know what and how to do in patient education. So in this, I want to give you one example of a patient this particular patient was a L4 L5 disc prolapse, and she was on bed rest for good 2 weeks. When she came to us, वो सिर्फ एक करवट पे ही ट्रीटमेंट लेती थी because she was not able to sleep straight on the back. आफ्टर 3-4 days शी वॉज एबल टू स्लीप, लेकिन एक कंप्लेन था उन्हें कि मैं मेरा पैर सीधा नहीं कर पा रही हूँ, राइट साइड में सिम्टम्स थे. सो शी वॉज लाइक कि मैं मेरा पैर सीधा नहीं कर पा रही हूँ. जब मैं मेरा पैर सीधा नहीं कर पा रही हूँ तो वो क्यों नहीं हो रहा है. बस my team was there and they were like, okay ma'am, let's see क्यों नहीं हो रहा है and all. And when I assessed her, we came to know that the psoas major muscle, which is having origin from L1 to L5 and insertion at my superior at along with iliopsoas, that is the area which is actually affected. The psoas was affected. So with the help of osteopathic techniques and certain exercises, we released a psoas muscle, and the knee, which was bended for good 15 days, was straightened in 5 minutes because we were able to locate the source of symptom. We were able to locate कि कौन से मसल से ये तकलीफ हो रहा है. That's the importance of locating the source of pain. And the source of pain is so important क्योंकि अगर हमने सही जगह पे ट्रीटमेंट दी है तभी हमें सही रिजल्ट्स आएंगे. सो नाउ इन पेशेंट एजुकेशन, जैसे मैंने आपको बताया, वी शुड बी अ लिसनर. पेशेंट में बी टेलिंग अस दे डायग्नोसिस. सो अगर कोई आता है, जैसे पहले भी मैंने बोला, क्रॉनिक डिजेनरेटिव चेंजेस, सो दीज आर द नॉर्मल एज चेंजेस. इंस्टेबिलिटी है पेशेंट को, लिगामेंट इंजुरी है, इन पे इंस्टेबिलिटी है, जहाँ पे उन लोगों को बोला जाता है कि बहुत मूवमेंट करोगे तो जॉइंट सटक जाएगा. सो हमें ये बोलना है कि आपको स्ट्रेंथ और कंट्रोल नहीं है अभी, जो हमें लाना है, और उसमें ही हमें पता है कि स्ट्रेंथ आने के लिए, बैलेंस ट्रेनिंग आने के लिए कितना टाइम लगता है. अगेन, वेयर एंड टेयर is normal age changes. So degenerative changes, normal wear and tear, these are the aging changes which are happening. Tear in the muscle, जिसको हम नॉर्मल लैंग्वेज में मसल पुल बोलते हैं, जिसके खुद के 4 डिग्रीज होती हैं. सो दीज आर देयर. ट्रैप्ड नर्व. So trapped nerve is many a times the patient has trapezitis and radiating pain. लेकिन मेडिकल डायग्नोसिस लेके वो हमारे पास क्या आता है, सर्वाइकल रेडिकुलोपैथी, सर्वाइकल स्पॉन्डिलाइटिस. एंड जब हम देखते हैं तो इट इज ओनली द ट्रोपेजियस which is in a lot of spasm, and once we release the trapezius, the radiating pain also goes, because we are working on structures and muscles which are the source of pain, not the X-ray and MRI which are telling that it is cervical spondylitis. So that is the importance of knowing the source of pain, the type of pain, okay, and how the pain is there. What is the healing period of these structures? Will, if we know well, we will be able to tell the patient कि actually treatment के लिए कितना duration लगेगा. जब हमें ये सब पता रहता है तो we are confident that how much we are doing, how much we are charging, and what will be the prognosis of the patient. ठीक है. So अगर disease बोलते हैं, so one we had one psychiatric posting. I was in KEM, so we had Dr. Patkar, and she was very good. She was very good. And she used to always say that never say while case presentation that this patient is diagnosed of schizophrenia. This patient is suffering of schizophrenia. और दिस पेशेंट, एंड फिर हमने भी फिजियोथेरेपी में यही किया, हमारे मेंटर्स ने भी यही सिखाया कि दिस पेशेंट इज सफरिंग फ्रॉम लो बैक पेन. A patient cannot be diagnosed. Yes, of course, it is the medical diagnosis, but when we talk about physical diagnosis, they are suffering from that low back pain. They are suffering from knee pain. And after that, yes, medical diagnosis में ONE है, lumbar spondylitis है, lumbar canal stenosis है, जो भी है. But disease is a condition. It is not the patient as a whole. So your one word can change the attitude the patient is looking at you with. मतलब जब पेशेंट को पता चलता है कि नो, दिस doctor is actually giving me time to listen, then all your sessions become very easy. The first session is something which will help you to gain the confidence of the patient. कंसल्टेशन अगर बराबर नहीं हुआ, आपने उनको एजुकेट बराबर नहीं किया, आपके बेसिक असेसमेंट बराबर नहीं है, सो उसके बाद में the issues start that they are not clear that what they are doing. As I told you, physiotherapy still lacks a lot of awareness. So we are here to educate the patient. And yes, this is one of the reason that since last 18 years, we have treated the three generations of family: the grandmother, the son, and the daughter. So granddaughter, grandmother, and son. ऐसे because they know कि whatever we are going to do, we are going to get results. And this is one of the reason that we have named our YouTube channel also Dr. Smriti of Family Physio, because we just don't treat one patient, we treat the family if we use our words carefully in a first consultation. I have seen physios who say, I'm sorry to say that origin insertions are just a joke for physios. No, they are not. Of course, they are not. They are something which has helped me to build my practice over the period of time. So, if there are some other conditions in the patient where we cannot do much, like patient is having knee pain, they are having some other deformity with that, so we need to tell them ki you need to make some adjustments. We will give them some braces, some other conditions will help them. In some other conditions, we will give them some external support. And we need to tell them that we have to adjust. Lifestyle changes हम जिसको बोलते हैं, बायोमैकेनिकल चेंजेस जिसको बोलते हैं, फ्लैट फुट है तो आप ये यूज करो, आर्चेस यूज करो. So these are all the important things which you need to say as a physio. So we need to avoid medical jargons. The patient who's coming to us is not from a medical background. So जितना हम simple language में बोलेंगे उतना वो better रहेगा. So choose words that empower them. So aging instead of degeneration, as I told you. So in patient education, we have to be very honest about the prognosis and duration, because this would go a long way. If in the first session only you will say the patient, हाँ 7 days आप treatment ले लो, फिर उसके बाद हम देखते हैं. Every day the patient will ask you how much days will be required. If in the first session you do assessment and clinic assessment and prop assessment properly, and uske baad mein you will tell them properly, then it is always better that they get to know what is important for them. So any questions? We will take a 2 minutes break over here, and I will just go through some questions which you have. Again, we will have so somebody has asked the QL and knee relation. So I was talking about the psoas and the knee. So the origin insertion of QL muscle, we should see how it is. So when there is any pain in the knee and you palpate between your navel and the ASIS, which is your psoas major muscle, there will be tenderness. Because when there is knee pain, what is the most common position the patient wants to take is knee flexion. नी फ्लेक्शन अगर होता है तो हिप पे भी फ्लेक्शन होता है. अगर हिप पे फ्लेक्शन होता है तो मेरी जो स्वास मसल होती है जो हम मेरे हिप जॉइंट के आगे इन द एंटीरियर एस्पेक्ट इंसर्ट हो रही है, ठीक है, वो कहाँ से आ रही है, L1 से L5. द ओरिजिन इज देयर एंड द इंसर्शन इज देयर. सो इट इज ऑलवेज इन द शॉर्टन पोजिशन. When it is there in the shortened position, the severity of tightness at the psoas pain will tell me the severity of knee pain. So when I will palpate the psoas muscle, I will come to know how much chronicity of knee pain is there. Sometimes the patient may tell you सिर्फ 5 दिन से 5-10 दिन से मुझे pain है. If the patient is having tightness even at the source on deep palpitation, that means the pain is chronic. It is not an acute pain. Okay, so this is about the QL, brain and gut connection. Yes, brain and gut connection is, it is a proven thing that your gut is your second brain. So if you go for exams, there are butterflies in your stomach. This is a well-known proverb. There are butterflies in your stomach. So these butterflies in your stomach are the stress which is there producing in your brain. Okay. And when the stress is there, the digestive system reacts to it because the vagal nerve stimulation, the immunoresponse, the axis, all these gets activated. In Parkinson, in stroke patients, or say in neuro patients, in a lot of these patients, we have seen that there are digestive issues. Patients who are undergoing stress and have low back pain also, they have digestive issues. So that's the area where I use a lot of osteopathy. So brain and gut connection is something which needs to be dig down and see that how it is related to physiotherapy. In simple terms, over here, I want to explain that we should not underestimate the digestive issues when in the history when the patient is having back pain or any neuro condition. Okay, so now we will see about the documentation. So I feel the documentation part is very important because every time we see a patient, we feel that, okay, this is something that this is just a knee pain. इससे कुछ नहीं होने
शेत
वाला
झाला
है.
असं.
This is just a knee pain, probably.
तिच्या हाताने दे खायला, कधीची खाती, 2 तास झाले.
This is probably just a knee pain, what I will document. So let me show you this video. This patient came to us from Baroda and her daughter is staying over here. So she was asked to undergo a repeat TKR. She had not done any physiotherapy post her first TKR, which was 3 years back. She was asked to do a repeat TKR saying that there is some problem and see what results we got. There was no range restriction. There was no other issue. But what we got is this. 1. Very good. 2. Very good. 3. Very good. Very good. 5. Up. Down. Up. Down. Up. Can you see how the patella tracking has improved? Can you see just superior to the patella how the muscle mass has improved? Yes. How the alignment is improved. अगर हमें ये लगता था कि ये केस ऐसे ही है, हमें सिर्फ नी पेन ट्रीट करना है, सो हम लोग ये रिजल्ट्स डॉक्यूमेंट नहीं कर पाते हैं. एंड देयर इज अ वेरी नाइस वीडियो विच आई वांट टू शो यू ऑल.
Stop using this so much that it actually pushes you away from the real magic. When you just go for it and decide to just play, that's when the magic happens. Stop using this so much that.
So I hope the video was visible.
Yes.
Okay. So if you feel that ओके ये पेशेंट है एंड इसमें तो नहीं है, इसमें क्या ही डॉक्यूमेंट करेंगे, बट दीज आर योर असेसमेंट स्किल विच विल हेल्प यू दैट द patella is not tracking as it should. So to know the abnormal, you should first know the normal. So this is how we have documented this case, and the ortho was so much happy that okay मेरा काम एक कम हो गया ऑपरेशन का. But then he was like कि okay what else we can do for this patient, and we worked very well on the balance and proprioception of this patient, and we got beautiful results. Okay, so when I showed you this Virat Kohli video, I intend to say that whether it's any patient, please document it. Your documentation can make one case as your wow case, and it will help you in your publication, or at least it will help you in your documentation, and it will give confidence to other patients also when you show them their results. And this small tracking may not have been visible to the patient, but जब हम फॉलो अप करते हैं ये पेशेंट के साथ, तब हम उनको बता सकते हैं कि इतना इतना इंप्रूवमेंट हुआ है. दिस इज कॉमनली सीन इन शोल्डर जॉइंट पेशेंट्स ऑल्सो. फ्रोजन शोल्डर के जो 70 डिग्री अबडक्शन का रेंज लेके आते हैं, 3 दिन के बाद 90 डिग्री होता है, वो उनको नहीं समझता है, लेकिन वो हमें समझता है. Because we are documenting, we are taking the photographs. And this is one aspect, patient aspect. Physio aspect would be कि you are able to know better that how the progression is getting done. अगर progress नहीं हो रहा है तो change the plan. And third, when you are sending this patient back to the referring doctor or back to the doctor from who has told them to do certain procedure, they know ki, okay, wherever they are taking physiotherapy, that is a person who knows her basic. That is a person who knows what they are doing in physio. Okay, so quality improvements are in patient are also marked as progress. Because the patient was walking limping, of course I'm not able to change the medial joint line gap which has come. Okay, there are certain techniques by which we can change that also, but we are not able to give that. But quality of walking, quality of staircase climbing can be very well documented. So this is what I feel that we should definitely document everything we do. Any questions? Anybody has any questions? We are going to take it in the last. Yes. PMF therapy helps patient. Yes. Yeah, PMF definitely helps the patient. I will take this in the last. But before that, I want to show you one video, which is probably around 3-4 minutes, but I want you all to see this video.
ये कहानी है दो बच्चों की जो एक गांव में रहते थे. उनमें से एक 6 साल का था और एक 10 साल का. दोनों बहुत अच्छे दोस्त थे, बिल्कुल शोले के जय और वीरू जैसे. दोनों हमेशा साथ साथ रहते, साथ साथ खेलते, साथ साथ खाते पीते, साथ साथ नहाते धोते. नहीं धोते नहीं, ये थोड़ा ज्यादा हो गया. तो एक दिन वो दोनों गांव से थोड़ा दूर निकल गए और खेलते खेलते उनमें से जो बड़ा बच्चा था 10 साल वाला, वो कुएं में गिर गया और जोर जोर से चीखने चिल्लाने लग गया क्योंकि उसको तैरना नहीं आता था. अब जो दूसरा बच्चा था छोटा सा 6 साल का, उसने अपने आसपास में देखा और उसको कोई नजर नहीं आया, उसको कोई नहीं दिखा जिसको कि वो बुला सके हेल्प के लिए. और फिर उसकी नजर पड़ी एक बाल्टी पे जिसपे एक रस्सी बंधी हुई थी. उसने एक सेकंड भी वेस्ट नहीं किया, उस बाल्टी को उठा करके कुएं में फेंक दिया और अपने दोस्त को बोला कि पकड़ ले इसको. उसके दोस्त ने पकड़ा और वो अपनी पूरी ताकत लगा करके पागलों की तरह उसको खींचने लगा. खींचता रहा, अपनी पूरी जान लगा दी उसने. छोटे से बच्चे ने 6 साल के और 10 साल के बच्चे ने उस बाल्टी को पकड़ा हुआ था. खींचता रहा और तब तक नहीं रुका जब तक उसने अपने दोस्त को बचा नहीं लिया, जब तक वो बाहर नहीं आया. अब यहां तक तो ठीक था, यहां तक तो ये कहानी समझ आती है. लेकिन हुआ क्या कि जैसे ही ये दो बच्चे जब दोनों एक हो गए, जब बाहर आए और आकर के गले मिल रहे, रो रहे और खुश हो रहे, एक तरफ से उनको डर भी लग रहा था. डर था कि अब गांव जाएंगे तो बहुत पिटाई होगी जब उनको बताएंगे कि ऐसे हम कुएं में गिर गए और ये सब चीजें हुई. लेकिन मजे की बात, ऐसा कुछ भी नहीं हुआ. वो जब गांव गए और जा करके उन्होंने अपने घर वालों को बताया, बाकी गांव वालों को बताया, तो किसी ने विश्वास नहीं किया, पूरे गांव वालों ने. और वो अपनी जगह बिल्कुल ठीक थे क्योंकि उस बच्चे में इतनी ताकत भी नहीं थी कि वो एक बाल्टी पानी से भरी हुई वो उठा सके. तो इतने बड़े बच्चे को इतनी ऊपर खींचना तो बहुत दूर की बात है। लेकिन एक आदमी था उस गांव में, उसने विश्वास कर लिया। उनको सब रहीम चाचा कहते थे, उस गांव के सबसे समझदार बुजुर्गों में से एक। और सबको लगा कि यार ये कभी झूठ नहीं बोलते, अगर ये कह रहे हैं तो जरूर कोई ना कोई बात होगी, कोई ना कोई वजह होगी जिस वजह से ऐसा कह रहे हैं। और फिर सारे गांव वाले इकट्ठे होकर के उनके पास में गए और जाकर के बोले कि देखो जी, हमें तो कुछ समझ आ नहीं रहा, आप ही बता दो कि ऐसा कैसे हो सकता है। तो उनको हंसी आ गई। वो बोले कि यार इसमें मैं क्या बताऊं, वो बच्चा बता तो रहा है उसने कैसे किया। बाल्टी को उठा करके कुएं में फेंका, उसके दोस्त ने बाल्टी को पकड़ा, उसने रस्सी को खींचा और अपने दोस्त को बचा लिया। तो आपको पता तो है उसने कैसे किया, बच्चा बता तो रहा है, इसमें मैं क्या बताऊं। तो सारे गांव वाले उनकी शक्ल देख रहे। फिर कुछ देर बाद वो बोले कि सवाल ये नहीं है कि वो छोटा सा बच्चा ये कैसे कर पाया, सवाल ये है कि वो ये क्यों कर पाया, कि उसके अंदर इतनी ताकत कहां से आई। और बोले इसका सिर्फ एक जवाब है, सिर्फ एक, कि जिस वक्त उस बच्चे ने ये किया, उस टाइम पे उस जगह पर दूर दूर तक कोई नहीं था उस बच्चे को ये बताने वाला कि तू ये नहीं कर सकता।
So yeah, I hope this video was audible, visible to everyone. Yeah, I want to tell you just one thing. This story was shown to you just to tell you कि हर एक पेशेंट हम ट्रीट कर सकते हैं। जब वो अर्ब्स पाल्सी का पेशेंट मेरे पास आया, it was referred to me by my guided to by my mentors also. But then there was nothing that nobody that told me कि ये हो नहीं सकता। सर्जन ने उनको बोला है कि 12 साल के बाद ये ठीक होगा, बट एज अ फिजियो दैट इज अ पावर। We underestimate ourselves, so we always need mentors to hold us, to guide us, and we need confidence in ourselves also, that this is a condition which I will be able to treat. This is a condition where physiotherapy will make a difference. So this is about knowing. And yes, the fifth and important part of starting the clinical practice, or the key of successful clinical practice, is be a lifelong learner. Keep on learning things. It is not important that you are doing only physiotherapy things, but it is even important to add on to your knowledge when it comes to healing of the patients. It is not a recommendation from my side, but it is an absolute professional need of the time. What we learn in the college, it is different, but what we apply in the patient is different. We recently had a case which is very, very rare, that is peroneal herniation. A runner had peroneal muscle से hernia बाहर, ठीक है, एक बम्प आता था, एंड ही वाज लाइक कि मैम पता नहीं, मुझे डॉक्टर ने बोला अल्ट्रासाउंड कराओ, अल्ट्रासाउंड इन द सेंस सोनोग्राफी कराओ एंड एमआरआई कराओ, फिर हम देखेंगे क्या है। एंड व्हेन वी पाल्पेटेड वी वर एबल टू लोकेट द एग्जैक्ट पेन, because the feel of that muscle was different, the feel of that skin was different. That is the importance of your hand. A physiotherapist's hands are like Midas. You touch and you can feel where the problem is. And when we told the patient that I am able to see a difference in this area, and he was literally, that patient was a runner, and he was literally, ma'am, nobody was able to diagnose the area of pain, but you did it. So that's the magic of physiotherapy, and that's the magic of you being a physiotherapist. So this has come to me after being a lifelong learner, and when you are doing that, it is always better that you upgrade yourself, reflect back, see what you have learned. Sometimes you have to unlearn, and you have to be up to date. Your upgradations will always help you to be confident. See, healthcare is revolving very rapidly. When I had passed out, I was not even aware about osteopathy, not about matrix rhythm therapy. Matrix rhythm therapy is 12 years old to India. We are practicing since last 9 years in our clinic. But yes, there were so many things which I had to learn, unlearn, go to my mentor, learn under them. Okay, dry needling, taping, cupping, all these techniques helped me to evolve as a physiotherapist. Again going back to my basics, even if I am doing dry needling, क्योंकि अगर मुझे पता नहीं रहेगा कि ये पेन कौन से मसल से आ रहा है, आई एम नॉट एबल टू टेक दैट पेन. Okay, so mentors and system, if you cannot see where you are going, ask somewhere who has been there before. And that's the reason we have started this mentorship program. This free webinar was absolutely to tell you that what wonders you can do as a physiotherapist, what is the importance of having physiotherapy mentors in your life. And they will help you to actually trace your goals, revamp them, again make your goals again. But lifelong learning is a system that keeps your clinical goals and growth on track. So we have a special session tomorrow, which is having all these things